Welcome to Folding Towels, a podcast for massage therapists with Jackie and David. If you are enjoying our episodes and want to support the production, consider buying us a coffee. Your contributions help us bring you more insightful discussions and expert interviews. Follow the link in the show notes or visit buymeacoffee.com/Folding Towels podcast to contribute, and thank you for your support. Today on the Folding Towels podcast, we're diving into a powerful and overlooked side of massage therapy, its role in paediatric oncology. Our guest today is Mandy Bartovolich, and she has spent over 25 years as a massage therapist, with much of her career dedicated to working in healthcare. She is the first paediatric hematology and oncology massage therapist at the University Hospital's Rainbow Babies and Children's Hospital in Cleveland, Ohio, where she helps kids and young adults facing cancer and blood disorders to manage pain, stress, and anxiety through integrative massage therapy. Mandy isn't just providing comfort, she's changing the way that hospitals look at massage therapy. She's played a key role in research that proves massage can be as effective as medication for reducing pain and anxiety in young patients. Her work extends beyond patients to include support for parents, NICU families, and even hospice care. So today we are talking about the power of touch in medical settings, what it takes to integrate massage into pediatric hospitals, and the emotional side of working with kids in challenging health situations. Mandy, welcome to the show. It is great to have you with us.
It's great to be here.
Now I'm going to get started with the question that we ask all of our guests. Who is your favorite superhero and why?
Superman. I would love to be able to fly anywhere I wanted to fly. I love to be in the air. So anything to do with air, I'm there, and I love Superman.
Amazing. Having X-ray vision would come in handy as well.
That'd be great.
Yeah.
That would be wonderful.
Especially working in the healing profession.
I know. Could you imagine? I'd be like, yeah, I'm pinpointing it right there. I can see it.
Yeah. It would just be great to get to that point of they do the thing and they go, oh, you're right. Yeah, I know. I informed you thusly. Now, I'd like to talk about how you came to be a massage therapist and what motivated you to step into the world of massage therapy.
I really fell into it. I was a medical assistant, and I was working with somebody, and I worked in the ER for a long time. Give my age away if I tell you how long. And I wanted to do more. I wanted to be more of a supportive instead of poking and prodding and giving shots and drawing blood. And somebody I was working with said, have you ever thought of massage therapy? And I went to the orientation, fell in love with it, and I've been doing it for 25 years.
That is a decent service.
Yeah.
We often talk about how the average life of a massage therapist is only about 5 to 7 years.
Yeah.
What is your secret to staying in the industry for so long?
You have to take care of yourself. I get massages once a month. I also stretch every morning and every night. And I even stretch a little bit at work too. And knock on wood, I haven't had any problems with my hands. So I really try to take care of myself because I love what I do. So I want to do it until I retire.
Yes. There are plenty of therapists who are as bad as their clients.
Mm-hmm. Absolutely. Yes.
And don't take care of the most important tool in the toolbox.
Exactly.
Yeah.
Exactly.
Yeah. Now you've got a particular focus, which is different to many aspects of what massage therapists traditionally think about doing when they graduate. And you specialize in pediatric massage therapy, particularly in the hospital setting. What can you share with us about that?
Well, if you ask me, I have the best job in the world. I work with kids all day. I have worked with kids. I worked in the pediatric ER in a pediatrician's office for 23 years. And then I started this program at Rainbow, and I've been doing this for 6 years. So I would much rather work with kids than adults. Sorry. They're fun, they're resilient, and we have fun all day long. And it's nice to go into the hospital setting, and when I walk into the room, they get excited because they know that what I'm going to do is going to make them feel better, and it's going to help support them. I'm not coming in to poke them, prod them, and do anything that they don't want me to do. So they get really excited. It's fun.
Yeah. What do you feel is the most rewarding aspect of working with kids?
Probably because I work with hematology, oncology, just symptom relief, actually. Gaining that trust from them to have them let me touch them, and giving them the coping mechanisms to help themselves, so they have a little bit of control. I teach them acupuncture. I teach the parents reflexology, so they have a little bit of control over it also. And the one thing I do like too, and I stress this to the providers, I walk into the room and it's one therapy they can say yes or no to.
Yes.
And it's a sense of control for that child to say, no, I don't want a massage today. And I say, oh, that's perfectly fine. Call me when you do.
Yeah.
Symptom control. I give them a lot of acupressure points, especially for nausea and vomiting. And they're like, oh, that worked. I said, yes, that is something you can do for yourself when I am not here to help you.
Yeah.
So.
How, and that's an interesting one. There's this crossover between Eastern and Western medicines and approaches to the body. And how has that been received by mainstream medicine?
So I work with an amazing team. When I started the program, I'm sure there were some naysayers, probably a couple, but they were actually really excited bringing me on board. And so if I'm in a room, the providers, when they knock on the door to come in, they'll say, oh, you're getting a massage. I'm going to come back later. They don't even interrupt the massage. They look at it as a very important part of the child's day. And they'll call for me before they'll give a medicine, which is nice because I work with a lot of constipation. So that before they do a bowel regimen because I work with sickle cell also, and sometimes they have like opioid induced constipation, and in my oncology patients, vincristine can make you really constipated. So before they do that bowel regimen, they're like, let me see if Mandy's available to do, they call it the poop massage. They call me the poop whisperer.
Yeah.
Okay, that's great.
Do you have that on your name tag?
I know, I need a t-shirt. But yeah, it's crazy. It works. And so the doctors really have embraced me since I've been there. Honestly, it might have only taken about a month or two before they're like, wow, this really works. This is amazing. So they call for me. So it's really cool. I have a great team.
Yeah. There's a book that I've been reading called A Spark in the Machine, where this text is this a Western explanation of Eastern medicine, and this doctor in the ER who often performs acupressure when other things haven't worked, to the surprise of his colleagues who continually say, "Oh, I didn't expect that to happen."
Yeah.
And even as I look across the forums with massage therapists, at one extreme, you've got the therapists who are into and open to almost anything. And then those who are just so closed to, it's just muscles, it's only bones, it's only nerves, this is how things are. And you'll see them continually write, I saw pictures of organs on the feet, that's a no from me. And I admit to have been in that position at one point until my eyes were opened by things that did work that I wasn't expecting.
Yeah, that's how I felt about reflexology. I was like, ow. And then I started using it, and I'm like, wow, this really works.
Yeah.
So
can you talk a little bit about the children who come into the hospital and where they're at with their health and the types of things they are experiencing?
Sure. So I see inpatient and outpatient, and I see ages newborns all the way up to like 26, 28. Sometimes we'll see an adult that has a childhood cancer and we'll treat them in the pediatric world, but they can usually in outpatient, they're feeling pretty okay. And I'm treating more anxiety in outpatient because they're
Yeah.
anxious about having to come in and have treatment. When I am treating inpatient, I will go from the inpatient oncology hematology floor to the PICU, which is our ICU, to the ER. So wherever my kids go, I go. I'll go to the OR. All they have to do is call for me. So they can
Mm.
be intubated. I'm thinking about my day today. I
Yeah.
can have a patient that's intubated, or I can have a patient that's feeling good. They're just getting their treatments in the hospital, and we, massage or we play a game of Uno.
Mm.
So the day to day, the minute to minute really changes. And I had a person shadow me yesterday. She's like, this is crazy. You're going from somebody that is, healthy, and now we're going to the PICU, and now we're going to somebody in respiratory distress, and now we're going to somebody that's vomiting. And I said, yeah, that's just how the day is. So you never know what you're going to get handed to you.
Yeah.
So you have to be very resilient. And you have to be able to pivot.
Yes.
So, and I
Yeah.
also go to hospice. So if my patients end up on hospice, I follow them to the end,
Hmm.
and I will go out to hospice
Yeah.
to see them. So that was not something that I thought of until probably within that first year of starting the program. I had a little girl that her parents said she kept asking for you.
Mm.
And I was like, well, guess I need to go back to the homes and follow through with what I started.
Yeah.
So I'll go out to the homes.
Yeah. That's quite a powerful testament to the value of the of your work. And what a beautiful, beautiful thing.
Mm-hmm. Yeah, I
Yeah.
agree. I agree. So,
Mm.
what a, I think it's a privilege to give somebody that peace before they transition over. It's
Yeah.
definitely a privilege.
Can you share a memorable story that highlights the impact of massage therapy on a young patient?
Sure. I have a lot. I think one that sticks out to me the most is when I first started, I had a patient. He was actually in the cardiac unit, but with a hematology oncology diagnosis, and he had went into respiratory arrest and cardiac arrest many times during his stay, and he was there for over 2 years before he went home. And I
Mm.
went down. I know. I took him outside once. I got permission from the doctors and nurses. I said, I have to bring this kid outside. He's got to get outside. And it was amazing. But he was he was going downhill quickly. And I went into the room and I just put my hands on his head, and he was not English speaking. And I just kept telling him, I'm here, I'm here. And I slow, gentle movements on the head. And you could see his blood pressure was starting to regulate, his heart rate was starting to regulate. And the doctors that were standing around kept saying, what is she doing to him?
Yeah.
And when I was finished, the doctor looked at me. He said, you just saved him a PICU admission
Mm.
just by being present, just a calming presence in the room, and that's what he needed at that time. So that's
Mm.
probably my biggest one that stands out to me.
Yeah.
And then I had a girl today. Oh my gosh, it was so sweet. I She went to school. She's now a doctor and she works in a hospital in New York, and she said, I want you to know how much you inspired me because I made them get a massage therapist for my unit. And
Fantastic.
oh, I love that. So yeah, she told me that today, and I was like, "Oh my goodness, that's
Yeah.
amazing."
Yeah.
So
Yeah, that is amazing.
I know
Yeah.
I was pretty shocked by that. I'm like, "That's good for you. Good for you for advocating for your patients." So.
Hmm. What are some of the biggest challenges in establishing massage therapy in a pediatric and oncology unit?
Well, it took me 4 years to get this program up and running. Uh, People don't put a lot of thought into pediatrics, which is sad.
Mm.
There, it was, That's not a priority. Um, Not right now. I mean, I heard so many excuses for that 4 years. And finally, I got my own funding and presented, I have my own money. Can we
Mm.
please start this program? And that's how it got off the ground. But yeah, it took me 4 years to
Mm.
get it started and taking the certifications and the courses to educate myself to start the program. So funding right now is probably the biggest because I work off of philanthropic money every year. So every
Yeah.
year I hope to God that I have money to
Yeah.
keep it going. So,
Yeah.
but I think that they really see that it's helpful. It's helpful for the patients, the parents, and for the staff.
Some of our listeners will be asking, how do you get started in pediatric massage and what are the types of qualifications that you might need? We can often be quite technique centric rather than human focused. And what advice would you have to a therapist who is looking to work with children more in the future, particularly in that hospital setting?
So I think the thing that helped me the most is because I worked in pediatrics for so long, and I worked in a very high stress environment. I worked in the ER, and I think that helped me connect with the staff, and it helped me connect with the kids. I also took courses in pediatric massage and pediatric oncology massage. Right now, I'm taking a certification called Empath, and I'm taking it with Heal Well. And I'm looking at their hospital based massage program. They have one for adult and pediatrics. And I just think that it's a need. It's definitely a need because it's not going into a child's room is not like going into an adult's room. We're teaching our children don't let strangers touch you. And
Mm,
now all these strangers are touching you. There's a
yes.
whole different way to approach a child. There's a whole different way to massage a child. I mean, you're not massaging a child like you would an adult. You're not getting your elbows and your knees in there, and you're not doing
Yeah.
any type of deep pressure. And um, also looking for the cues of that child because they may be nonverbal or they may be 2 years old and not have the words to express
Mm,
to you. So being present with that child. So there's a I think my background is why the program is what it is
yeah.
because I worked with kids for so long. But yeah, I would say you definitely have to have the education. You have to take a really, really good course to be educated in what to do with children, especially in oncology.
There's some cultures where parents touching their children therapeutically is just part of who they are and how they grow up. And then that translates to children will often care for their parents, their grandparents, and other elders through therapeutic touch. Do you feel that there's perhaps an absence of that, or not so much an absence, but parents don't necessarily know how to touch their
Yes,
children, particularly when they're in
absolutely.
distress?
Absolutely. And I think they're scared.
Mm,
I think they're scared they're going to break them. So, or they're going to hurt them in some way. So I go over techniques to use for the parents, and I have little handouts for the parents. Um, and I will guide their hands while
mm,
I'm massaging. Like, I'll massage this leg, you massage this leg, and guide them along the way. And there's been times where my patients, if they're intubated, they're in the PICU or fragile. they need their parents' touch, and the nurse and
Mm.
I will help them get into bed with them and snuggle them because they need
Mm.
that. And you can tell that they relax because they just need that nurturing touch. But
Yeah.
I do think that we don't touch enough over here anyways.
Mm.
um,
Yeah.
yeah. And I'll walk into a room and my patients and my parents, can I have a hug? I'm like, absolutely, you can have a hug. Sometimes it just
Yes.
takes that. You just need a hug.
Yeah.
But yeah,
Do you feel there's a trickle-on effect from what you do within that hospital setting into that child's home life?
I do. Yes. Yes, I do.
Mm.
Um, you just made me think of one patient. She had a rough home life, and I think it might be generational. Maybe the mom was raised that way and not touched in a good way,
Mm.
therefore did not touch her child in a good way. And we really worked on that. She followed me, she watched me, and her daughter talked to her and said, "Mom, this feels good, that feels good." And she really tried. She really
Yeah.
tried. So yeah, I do think that
Mm.
it helps at home.
Yeah.
So, and I have like little 2-year olds or even 18-month-olds that they'll be at home and they'll stick their feet up in the air, and the parent is, what do you need? And they're like, massage my feet. So they
Yes.
start massaging them at home, which I love.
Perfect.
Yes, please touch your child.
Yeah.
Love them.
And we know that that is so good for the overall development as well.
It really is.
Yeah. So can you tell me a little bit about how, from that medical perspective, massage gets integrated into the overall child's treatment plan and how it then does complement conventional medical care?
So I think when I'm inpatient, everybody knows that they're going to get seen that day.
Mm.
They can call for me. The doctors will call for me for nausea, vomiting, constipation, headaches. I'll work closely with PT. It's like they have brought me into the team, so they've integrated me into the team. So when they feel that it's something that I can help with, they call for me, and that's why I'm running all over the hospital because I have patients all over the hospital. So I think they've just incorporated it.
Mm.
Honestly, I think it just came naturally.
Yeah. That's perfect.
Yeah,
Things
it
are
really
organic.
is. It really is.
Yeah.
Yes. I mean, I gave in services the first week I was there to tell them things that I could help with. And it really did. It was very organic. They just started calling for me and it blossomed from there. We didn't really have a protocol. We just kind of went with it and it built itself.
Mm.
So yeah.
Yeah.
I'm lucky I have such a great team.
One of the criticisms of the massage therapy industry is that there is not a lot of research, documented research, but you have been part of studies and you are a published author as well.
I know. Can you believe that?
Yeah, thank you. And you've had a recent study that demonstrated and quantified that massage therapy significantly reduces pain and
Mhm.
stress and anxiety in young cancer and sickle cell patients. What were some of the takeaways from that research and how was it received?
I was shocked. It went international. I was just, yeah, it was crazy.
Yeah,
um,
there was an excerpt in my professional journal of that paper.
oh, oh, wow. Thank
Yeah,
you.
yes.
Yeah, it was funny. And that again, that came along just out of the blue. I was talking to our researcher and I said, hey, we really need to do some research. And his boss looked at the numbers and he goes, oh my God, do you even know what we have here? So that's how that happened. And it's so amazing. And I don't think people talk enough about sickle cell. It's such a Oh, it's such a horrendous disease. And I love that we really highlighted the benefits of the pain, anxiety, and stress of the sickle cell diagnosis, because I love walking into a room and they're in such extreme pain.
Mm.
And when I leave, their anxiety has lowered by at least 2 points. Their
Mm.
pain has lowered by at least 2 points.
Yeah.
And they don't have to use as much opioids.
Hmm.
So yeah, they I think that paper opened a lot of doors, I hope, for a lot of people, and it just shows the benefit of having that one person, that support person, because all of the people that I saw um, with that paper, it wasn't just having hands on, it was a presence in the room also.
Hmm.
And that helped with the anxiety too. There was a part in the paper that talked about just the presence of being there, is because I am so integrated into the team. I'm not a contractor, so I
Yeah.
don't just come in. I get to know the staff. I work with them 40 hours a week, and I really get to know my patients. And I think that is really important, that it needs to be integrated into the hospital and not
Yeah.
just a volunteer coming in, putting hands on a patient. I think
Yes.
that's extremely important. So that was a huge takeaway of that paper.
And because you've got an extensive medical background as well, um, to be able to understand the pathologies, to
Mhm.
understand the treatment protocols,
Yeah.
and respect the decisions of the medical team too.
Yes. Yes. And
Mm.
I'm able to ask questions and they answer my questions. They take me through things. Like when I started, honestly, I didn't know anything about sickle cell. And we have an
Mm.
amazing sickle cell team that I could ask so many questions to, that made me understand what sickle cell was, so I could really dive into that diagnosis and help them.
Is there a cure for sickle cell?
So we are doing gene therapy for sickle
Yeah.
cell right now. Yes. And I can't go into the nitty gritty about it. That's Dr. Dalal all the way.
Yeah.
Smart man. But yes, we have, oh my gosh, one, three or four kids we've done the gene therapy with. And I just saw two this week, and they are doing amazing. They are absolutely doing amazing. And the one kid, he's not really, he's in his 20s. He's like, I'm going to go back to college. Like, I feel like I have my life back. I'm
Mm.
not having crisis anymore. I feel like I can go have a life. And he's just so thankful. And it's amazing to see how their lives are going to change,
Yeah.
because it's a horrible disease. It's a horrible disease. It's horrible to watch these kids go through this. The pain is just like no other.
I remember speaking with an anaesthetist once who talked about how, as people go under, so how they go under is how they come out. So if they're
Mm-hmm.
peaceful and calm, they come out well from anesthesia. If they're terrified, then they'll come out screaming and scared. So how do you approach? And that's just an example from anesthesia. But how do you approach therapy for children who may be feeling scared, anxious, or physically fragile?
I think first gaining that trust. So when I first talk to the child, I explain what I do on their level. You have to meet them where they're at. I explain what I do and the things that I can help with. And I think showing up, um, like I have a child that's going to go to the OR on Monday. It doesn't matter if he needs to be there at 5 o'clock in the morning. I'm going to be there. If he wants me there, I'm going to be there.
Mm.
And I think that's the most important part, is showing up for these children. It doesn't matter how old you are. I remember I think he was 23, big brute of a boy, and didn't like anybody. And I said he was having an 18-hour surgery. And I said, "Do you want me to be there?" And he said, "Yes." And I said, "Okay, I'll be there." I was there at 5 o'clock in the morning, and from 5 to 8, I was with him. And I really like how you said with the anesthesiologist, that's very eye opening because I think he was calm when he went
Mm.
back, and he was calm when he came out. So that's
Mm.
very interesting. So yeah, I would say showing up and meeting them on their level and talking to them and gaining that trust.
Yeah.
So I mean, I massage during poor access because that can be very anxiety inducing. Even coming into the building can be anxiety inducing. I've met kids in the carport
Mm.
and done a couple acupressure points or massage in the car before they come up because they just can't get themselves to walk in the doors. Uh, so yeah, I think that relationship you build is huge.
Mm. Do you feel inspired somewhat by Patch Adams?
Oh, I've seen that. I don't remember. I'm gonna have to rewatch it. I love Robin
Yeah.
Williams.
Yeah, rest his
I'll have to
soul.
rewatch it. I
Yeah.
know, right?
Yeah.
Yeah, I think a lot of my work is with the anxiety, especially in the beginning, especially
Mm.
at new diagnoses and just trying to connect with the family too. I mean, because I'm not just dealing with the child, I'm dealing with the parents too.
Yes.
So, I
Yeah.
have to you have to develop that bond with the parents too. And a lot of them have said, that I have the time to listen. I have the
Hmm.
time to be in the room. Where when you're a provider, I mean, it's boom, 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 because that's their job. That's what they have to do. And I have the time to sit there and listen and let them vent.
Hmm.
So, and I've been called to rooms to let the parents vent, so it doesn't turn into a code violet. That
Yes.
has happened.
Yeah.
I've been involved in many code violets. Some I can talk down, some are
Mm.
too far gone. So that's another thing too that they use me for is when I have that relationship with the parent or the child. If I show up and they're not too far into their spiral, I can get them to calm down.
Mandy, you also provide massage for parents and even NICU families. How does this support the emotional well-being of the entire family during a child's hospital stay?
So I massage the parents once a week inpatient. I don't really get a chance to do it outpatient. I don't have a space there to do it. But I started it and the parents started asking for it. It's nice for them to get out of the room for 15, 20 minutes. It's nice for their kids to have a little bit of a break from their parent because they don't want them in their room 24/7, and that's what
Yes.
ends up happening. And then the parent is less stressed when they go back to the room. We talk about a lot of things. Things have come out in these 15, 20-minute massages that they don't tell the staff. I've had parents tell me about past addictions, past that their husband and wife they're thinking of getting a divorce, and struggles at home, things that are going on at home financially or emotionally. And I ask them, do you mind if I have this staff member come into your room? Because I think this staff member could help you with that. It's things that
Mm.
they don't think to tell the provider about in the moment because, or they're just too scared or they're embarrassed to tell them. And the one that had the addiction, we set her up with AA meetings right down the street. So she was able to go to her meetings.
Mm.
And the NICU, I was talking to a parent in the NICU who became a parent coordinator in the NICU and telling her about the parent massages. She said, I want to do that down here. So she got a grant, and I have a
Mm.
massage therapist come in once a month and he gives the parents massages, and it has been going amazingly. These parents really, really need it.
Yeah.
So they go back a little more relaxed and they're not as frustrated.
Mm.
I think it's important. And I started a parent program where I have parent lockers too for comfort items, shower steamers, nice teas, things like that.
Mm.
So,
A little bit off topic. Over here, a number of our children's hospitals have a volunteer program where volunteers come in and all they do is hold preemie babies
mhm.
as part of that development and the need for touch. Do you have something similar?
We do. Yes, we do.
Yeah.
It's so important.
Yeah.
Touch is important. Like I
Yes.
said, I mean, some people just want a hug. I walk into
Mm.
the room and they're like, "Well, why didn't you hug me?" I'm like, "Okay, hold on, I'm coming." And during COVID, oh my goodness, you weren't allowed to
Mm.
touch, you weren't allowed to hug. And I,
Yes.
I had a couple parents say, I really, really missed your hugs.
Mm.
I needed a hug. So,
Yeah.
touch is important.
Yeah. How is it that we've ended up in such a touch-starved world?
I know. And COVID
Mm.
really, really did a number on us. I think it was bad before and then COVID hit. And now nobody wants to touch each other. It's horrible. It's horrible.
Mm. And certainly the development of child protection has had an impact on touch within childhood development too. And yes, people have done some terrible things to kids that they deserve every punishment that's thrown at them at the expense that we have stopped interacting with our children on a positive level.
No, I agree. I agree.
Mm.
And they do. They deserve to have the book thrown at them. I can't stand
Yeah,
that.
yeah. As far as I'm aware, the only pediatric massage training here in Australia is offered through the Little Kids Foundation.
Hmm.
What advice would you have to give to massage therapists who want to work in the healthcare or hospital setting, particularly around working with children?
That's where I was trained was little kids. I
Mm,
took the pediatric and pediatric oncology through little
yes.
kids. I mean, I learned a lot about when I took the oncology. I learned a lot about metaports and Broviacs and PIC lines. Those are things I didn't see a lot of in the ER. I think I wish there would have been more hands on where you go into the hospital.
Could you share a piece of advice you wish someone had given you when you first started in your career?
I honestly thought when I walked in, I was going to be able to schedule, like, this time you're getting your massage.
Hmm.
No, it does not work that way. It does not work that way. You have got to be flexible. You have got to learn to roll with it. Definitely have to have a thick skin. So have a thick skin because kids are so honest.
Mm.
um,
Mm.
that would probably be my biggest. I wish I would have had that advice because I went in there with, one way I was going to run it and it completely turned a different way.
Yeah.
So be open minded when you're working with kids.
Yes. They do say the darndest things.
Oh my gosh.
Yeah.
They're so funny. And their parents are like, oh my gosh. I'm like, it's fine. It's fine. I had one little boy. I just walked into the room so he could yell at me. I'm like, if you want to yell at me and not your parents and the other staff, go ahead. That's fine. Let's just get it all out. That
Mm.
was my support for him.
Yep.
So
Is there one key message you'd like listeners to take away from your journey, and what would it be?
keep going. I was told no so many times. And my husband can attest to this. uh, it, I kept pushing forward. I knew that this was something that was needed. It was a huge passion of mine, and I could see that these kids needed this
Mm.
support and this in their everyday life. So keep pushing, even
Yes.
if people tell you no. Keep going because it will
Mm.
happen. It may not happen where you think it might happen, but it'll happen.
Yeah.
Especially if you have the passion. And take care of yourself. For the love of God, take care of yourself. That's another takeaway. You got to take care of yourself. It's a really, really hard job.
Yes.
So emotionally, physically, it's a really hard job.
Mm. How do you take care of yourself emotionally?
Oh, I go to a therapist if I have
Mhm.
to, especially if I have a child. I I've had quite a few kids that I've been there when they have passed, and
Mm.
I just call and say, "Hey, I need I need a little tweaking."
Yeah.
But yeah, you have to take care of yourself that way too. You have to have somebody to talk to.
Mm.
I think that's very important. So that's one thing I learned when I was in Australia. You guys really take care of mental health there, and I wish that we took care of mental health as well as you guys do there. Probably the only thing I would say is, be present. Make sure you're present. And I had the student shadow me yesterday, and that was my number one to her. You have to be present.
Mm.
You can't be thinking about this. You can't be watching the TV. Don't be looking at your phone. Be present.
Yeah.
That's all they want.
Are you training others to work in a similar way to you?
I am not yet. It's being talked about.
Mm.
Um, but yeah, I would like to. I'd
Yeah.
like to.
And you mentioned the doctor who has engaged a massage therapist in New York. Do you
I know,
see
right?
the program spreading even
Yeah.
further,
Oh,
or is it
that
interest?
that warmed my heart. I couldn't believe it when she told me that. I'm like, oh my gosh. And her mom was so proud too. One,
Yeah.
that she's a doctor now, and two, that she's making a difference out there. I said,
Yeah.
that's
It
amazing.
starts with one.
Yeah. So, and she's been through it. So she
Yes.
knew what helped her. So
Yeah.
it was,
Change sometimes takes a long time.
oh, too long.
You planted the seed years ago.
Yes. One day, massage will be covered under insurance. That I'm waiting for. That's going to happen before I retire. I mean, it
Yep.
has to.
Mm.
So I'm pushing for it.
Well, for those who are inspired by what you've achieved, where can our listeners find out more about your work? And are you open to them getting in touch with you?
Absolutely. You can email me anytime. I might not get back to you right away because the time difference is
Yes,
uh, quite
it's
significant,
challenging.
but I will get back to you. Like it's dark here. I'm going to be going to bed soon.
Yeah.
You're just waking up.
Yeah.
But yes, absolutely. If you want to put my email up there, people can reach out to me. I will get back to you.
We'll pop an email in the show notes.
Okay.
Well, it has been a pleasure speaking with you today, Mandy.
Thanks.
I've loved our conversation. Working with children is not something they talk to you about when you're at massage school.
No,
And it's just one of those opportunities which you seem to have fallen into. I love that you've
mhm.
developed it so far and that you've achieved such respect within the medical community.
Thank
Thank
you.
you for your time this evening and or this morning, depending on when you're listening,
Yes.
which side of the time zone you are on. I really enjoyed talking with you.
Yes. Thank you so much for having me on. I really appreciate it.